Michael Weiner, professor of radiology, medicine, psychiatry, and neurology at the University of California, San Francisco, and I'm principal investigator of the Alzheimer's Disease Neuroimaging Initiative and the Brain Health Registry. I'm trained as a kidney specialist, and in the late 70s, I learned about a technique called nuclear magnetic resonance, or NMR. And I started using NMR to study the kidney in the rat animal model. And it was one of the very early studies of using NMR to study a whole animal. And NMR turned into MRI. NMR and MRI are the same thing. They just gave it a different name. So I was involved in doing experimentation with MRI at the very beginning of MRI. And I was incredibly excited about the power of using MRI to study all kinds of parts of the body, the kidney, the heart, cancer. And then I got interested in the brain, and finally in the late 1980s, I was looking for a disease that was difficult to diagnose that MRI could contribute to, and I chose to work in the field of Alzheimer's disease. The goal of the Alzheimer's Association grant is to use the Brain Health Registry as a website for obtaining information from patients who participate in the IDEAS study. The IDEAS study is a large study across the United States in which Medicare pays for amyloid PET scans on 18,000 people with mild cognitive impairment or dementia. Amyloid PET scans are a way that you can determine whether someone really has Alzheimer's disease in their brain. You don't need to do an autopsy anymore. If you have an amyloid PET scan, it will determine whether or not you have amyloid plaques in your brain, and the amyloid plaques are a hallmark of Alzheimer's disease. So there are many people out there who have a mild cognitive impairment, or people who have progressed and have some stage of dementia who would like to know whether or not they really have Alzheimer's disease or not. The scans are very expensive, and currently insurance doesn't pay for them. But the Medicare office decided that they would do a pilot study on 18,000 people, which is a lot of people, and so millions of dollars of Medicare money is going to be used to pay for this study. Unfortunately, there are no funds being available for assessment of the patients, except for a clinical visit by the doctors. So what we're going to do is we're going to invite people who have had amyloid PET scans from the IDEAS study to join our website registry. That is, the Brain Health Registry is a website where you can join it, you give your email, you can log in, and you provide all kinds of information about your brain health, your general health, what medications you're taking, your family history, and there are tests of your memory and other kinds of brain functions, as well as the opportunity to invite a study partner, might be a spouse or a family member or a friend, or to have a caregiver involved, because some people have dementia, they really need care, they need help, and a caregiver can also log into the Brain Health Registry and give information. So the funds from the Alzheimer's Association are being used to collect data from participants in the IDEAS study using our website, the Brain Health Registry. Well, our long-term goal is to prevent Alzheimer's disease. And this will all begin by finding a treatment that works in people who are symptomatic, and then by showing that these treatments can prevent it. By prevention, we mean someone who's normal, who's at risk for Alzheimer's disease, and they take a treatment and it prevents them from getting the symptoms of Alzheimer's disease. That's what we want to do long term, and the only way we can do that is by doing clinical research to identify the risk factors for developing Alzheimer's disease, and then doing research clinical trials in which we show that we can prevent it. And the Brain Health Registry is a website which will recruit, assess, and longitudinally monitor people for prevention trials. And we're very excited about a partnership with the Alzheimer's Association to use the Brain Health Registry to accomplish these goals.